Another question I often get asked is, how do I know if I have a disc problem? I think in order to understand that, you need to learn a little bit about the disc. So let me show you a couple things. First of all, in the normal spine looks like this. You've got these normal curves. You've got a curve here, and a curve here. These curves that you see in the spine allow the spine to absorb the body weight when you step. When you take a step, your weight has to go somewhere. And these curves absorb the shock of the weight of your body. Sometimes something can happen when those curves are lost. For instance, if a low back looks like this and it's curved versus it looks like this and it's straight, the straightening of the spine can cause a compressive force. So when you walk, instead of that curve absorbing your weight, we get compression. If we get compression over time, what happens, these are discs, there are these little pores right here on the end plate of the bone that allow fluid in and out of a disc, because the disc doesn't have any direct blood supply. It's only nourished by fluid which is pushed through these pores on the end plates of the bone. Research shows that when the spine straightens out, the compressive forces cause these pores to seal off, and this keeps fluid from moving in and out of the discs, making the disc unhealthy. Over time, what occurs is that the disc, these little cartilaginous rings, there are hundreds of them, they'll start to crack and become dehydrated. The center, which used to be very firm, kind of like a gummy bear, gets more runny like syrup. Once this last fiber cracks, the disc itself can start to seep out, and it starts to look like this, and it can pinch the nerve. This is called a disc bulge or a disc herniation, and they can be excruciatingly painful. The patient may suffer just from back pain, but they could have pain down the leg. If it happens in the neck, they could be getting pain radiating back into the shoulder blade or down into the arm, or getting numbness and tingling into the fingers. They might experience headaches. Regardless, this is a serious condition. One of the most common and effective treatments for a disc herniation or a disc bulge is called decompression. And if you look further into the site, you can see us talking about decompression, so you can get a good explanation of that.